Hello everyone, this is Cindy Rogers from the Children's Safety Network at Education Development Center. I'm very pleased to welcome you to today's webinar, Tribal Injury Prevention, Successes and Challenges from the Tribal Injury Prevention Cooperative Agreement Program, or TIPCAP. Before we get started, my colleague Rebecca Wilmer will provide a few technical announcements for today's webinar. Rebecca?
All right, thanks Cindy. So audio is being broadcast through your computer speakers. The quality of the audio depends on the speed of your internet connection. So if the audio is choppy, please either find a more stable internet connection or you can mute your computer speakers and listen over the phone by dialing 866-835-7973. Phone lines will be muted during the presentation to eliminate any background noise. Answers to frequently asked questions are in the webinar instructions pod in the upper left. If you have any questions or technical issues at any time, you can type them into that Q&A box that you'll find over on the lower left-hand corner of your screen. After their presentation, we will pause for the presenters to answer your questions. There's also a PDF of the slides today in the file pod above the slide deck. So you can download them by clicking on the file name and then selecting the Download Files button to save the document to your computer. This webinar will be recorded and archived, and the archive will be sent out to all registrants within 2 weeks. Back to you, Cindy.
Thanks, Rebecca. So today we'll have 4 presenters, each with a tremendous amount of experience in their fields. We're very grateful to each of them for joining us today. Let me tell you a little bit about each of our speakers before they get started. Monique Shepard is a healthcare specialist with more than 23 years of experience in injury prevention, program management, and policy research and data analysis. Dr. Shepard leads the Econometrica Health Group and directs and evaluates projects using evidence-based solutions. She served as the project director of the prior TIPCAP award. Captain Nancy Bill is a U.S. Public Health Services commissioned officer and works as the Indian Health Service Injury Prevention Program Manager. Captain Bill is a certified child passenger safety technician, and she is an enrolled member of the Navajo tribe. For over 25 years, Captain Bill has provided leadership in saving lives by addressing the injury disparities in American Indian and Alaskan Native communities. Our third speaker, Kai Baker-Stringfield, is a senior level manager at Econometrica with more than 11 years of experience in program and project management, supporting learning collaboratives, capacity building, and training and education. Ms. Stringfield has led projects focused on improving health outcomes, ensuring quality of care, and building and sustaining program capacity. We're also very happy to have Norma Bowman. Norma is the program manager for the Navajo Department of Highway Safety. She has been working in the injury prevention and highway safety field for 25 years. Currently, Ms. Bowman serves as a National Child Passenger Safety Instructor, National Safety Council Defensive Driving Course Instructor, and Navajo Nation Safe Kids Coalition Chairperson. I'll now pass the microphone over to Monique.
Thank you, Cindy, and welcome everyone to today's webinar. We're going to begin with some polling questions. Rebecca, if you could bring up the first question. We want to know, who does everyone work for? Your choices are state agency, federal agency, nonprofit, or other. If you all could send in your responses now, that'd be most appreciated. About half of you have responded. About 60% of you have responded. 75% of you have responded. Still a few people responding. Great. Well, the majority of people here today are with the state agency, approximately 37.9%, or 41 of you. 10 of you are with a federal agency, or just over 9%. 38 of you are with a nonprofit, which is about 34%. And 20% of you are with another agency. And we'll try to cater the presentation to address your needs. We have another 2 questions. If Rebecca, you'd pull up the second. We'd like to know, have you worked with a tribal community before? Your choices are yes and no. And then after you fill in that question, we'd like to know, are you interested in working with tribes? Your choices are yes, no, and maybe. So for our second question, have you worked with tribal communities? The majority of you have responded, and it's an overwhelming yes. 62 or 62% of you have responded that you have, and 38 or just under 37% of you have responded that you have not. For are you interested in working with tribes? Again, another overwhelming yes with 92 or 92% of you saying yes, no one saying no, and 9 of you saying maybe. So you are in the right place for today's webinar because we are going to be able to address some needs that you have. And thank you for the polling, Rebecca. You can take that down. To start out today, first, we're going to hear from Nancy Bill, who will provide some background information and an overview of the Indian Health Service. Then, I'm going to come back on and present some information about the TIPCAP program, the technical assistance strategies that we use while assisting the grantees in implementing their programs, as well as a quick overview of the overall combined results from all of the efforts put forth by the grantees. After that, my colleague Kai Baker-Stringfield will discuss the details on several prominent case studies from the TIPCAP program that were very successful and the different strategies that each of those applied. Kai will then turn things over to Norma Bowman, who is actually a TIPCAP injury prevention coordinator, and she's going to share her experience as the leader of one of the TIPCAP programs and the successes that they had at the Navajo Nation Department of Highway Safety. And then finally, I'll come back on and wrap everything up before we take some of your questions. So with that, I turn things over to Nancy Bill. And Nancy, you can advance your own slides.
Thank you, Monique. Hi, everyone. This is Nancy Bill with Indian Health Service. The slide you see on your screen shows the mission of the Indian Health Service in partnership with American Indian and Alaskan Natives to raise their physical, mental, social, and spiritual health to the highest level possible. And the foundation is to uphold the federal government's obligation to promote healthy American Indian and Alaskan Native people, communities, and cultures, and to honor and protect the inherent sovereign rights of tribes. The Indian Health Service provides services to the 556 federally recognized tribes throughout the U.S. And on your screen you see a slide that covers the numbers of, just an overview of the hospitals, the clinics, and tribal health centers and stations around the country. One side is IHS, and the other side is tribally owned facilities on the screen. And then we also have urban centers that have the urban Indian health programs. And this is, again, within the Indian Health Services to the tribes. And now on the screen you see a map of the services of IHS divided into 12 regions around the country, and each of the colored part of the map shows the 12 regions of the service of Indian Health Service. And with each of the 12 service areas, we have, I'm going to be talking about our staff, the Indian Health Service injury prevention staff. We have contacts within the 12 regions that I will also talk about. Our program for the Indian Health Service Injury Prevention Program's mission is to raise the health status of American Indian and Alaskan Natives to the highest possible level by decreasing the incidence of severe injuries and death to the lowest possible level and increasing the ability of tribes to address their injury problems. Next on the screen you see the across the years data from the Indian Health Service from the 1973 to 2008. It's showing the difference between the Indian Health Service population and all U.S. The bottom line, the red line, is all U.S. population. The blue line is the American Indian Alaskan Native unintentional injury death rates. And just to give you a picture of the disparity that exists over the decades, to current, we are closing the gap. However, the disparity still remains. The next slide, to get a bit closer look, we see that motor vehicle is a leading cause of death, unintentional death in our population, closely followed by poisoning, which is closely catching up, and as you can see down the line. But motor vehicle is a huge issue that we are addressing. With the injury prevention program, it is a priority of our program. Has been over the decades. And the second priority is unintentional fall prevention, which is really focusing on elder falls because it's a leading cause of hospitalization within the American Indian Alaska Native population. Our priorities are set to follow best practice and evidence-based strategies. For motor vehicle, we focus on policy, environmental infrastructure, education, advocacy, unintentional fall, which I'm not going to cover in this presentation, but let's just let you know we have a comprehensive multifactorial focus on elder falls. Today's presentation is on the Tribal Injury Prevention Cooperative Agreement Program that started in 1997 with the Indian Health Service. Funded over, on your screen shows that we funded over $26 million in cooperative agreement grants to 136 tribal, urban, nonprofit, American Indian Alaska Native corporations, organizations. This cooperative agreement came about because, as you saw in the earlier slide, the disparity that we're addressing and trying to give tribes the capacity and resources to deal with their problems by giving them the resources to address the problems. This presentation for our current last cycle from 2010 to 2015, we had an emphasis on the motor vehicle, and again, I mentioned earlier fall prevention, but motor vehicle was an emphasis for our TIPCAP, or Tribal Injury Prevention Cooperative Agreement Program. And during that cycle, we have funded 25 sites that funded, were able to hire 25 tribal coordinators, and one of the things that happened out of that is that many of the coordinators became certified child passenger safety technicians, and 6 became instructors. And within that, we had over 100 CPS technicians through the effort of TIPCAP that were trained at the tribal program. The 33 sites, the 25, 33 sites for the last cycle, we had distributed throughout the country, and we also had 7 that were considered projects. The projects did not fund full-time people, but they funded projects within the different tribal programs. And again, the whole purpose was to build capacity with tribes and through training and resource development and infrastructure. So on the slide here, you see that capacity building was one of our emphasis. We also had, among the grantees, we had a tribal newsletter that shared all the successes and networking among the grantees and among our partners to let people know what we were doing throughout the 5 years. And many of our sites, in fact, all the sites, built partnerships, not only with the tribes, with the state and national level throughout the 5 years. We also had innovative, effective strategies that were implemented. Many of the tribes are able to get programs and implemented things that really help boost their programs, such as cultural integration of certain programs bringing messages and training to the tribal programs with the cultural aspect. We have the IHS project officers. From the 33 sites, we had IHS project officers assigned as the local technical assistant person, and each of the project officers were able, the first level of technical assistant in terms of building and helping the tribal coordinators in training programs, data, surveillance, resource development. And then the second level was Econometrica, the outside contractor for the TIPCAP program, which you will hear from Monique Shepard. And on the screen here, you also see a photo of the group that we had an annual workshop, and that's our group picture from last year, 2015. I'm just going to quickly show some success stories for TIPCAP. There was many successes over the 5 years, and the emphasis I want to show you is focused on motor vehicle. We know that all the sites that had objectives to reach or to attain increases in seatbelt in adults and children, child safety seat use, all had increases from 5 to some surpassed the state levels of occupant strength use. So all the sites, were fairly successful in raising seatbelt use and child restraint use. So on the screen here, you have the Kiowa Tribe, Ho-Chunk Nation, St. Carlos Apache. I'm not going to read each of the lines there, but each of the sites have reported the successes they had during the 5 years of funding. This next slide from Kaw Nation from Oklahoma, the Northern Native American Health Alliance, Ojibwe tribes of Bad River and Red Cliff Band of Lake Superior tribe of Chippewa Indians. These two tribes, again, or sites, also reported increases in successes in occupant and straight use. The Northern Native American Health Alliance also had a program on bullying prevention that they implemented in their school system. And the one thing that's not on the slide about this group is that they implemented Chippewa cultural factors or cultural things that are strategies that help with this bully prevention program. And they received national recognition from on this the program. The Pueblo of San Felipe and the Menominee tribe of Wisconsin also reported seatbelt use increases that were, again, successful over the 5 years. And with that, many of the decreases in injuries from motor vehicles were seen or experienced as well. I'll turn it back to Monique. Thank you.
Thank you, Nancy. So right now you're looking again at the map that Nancy showed you earlier when she showed you all of the 12 Indian Health Service regions. Our 33 grantees were focused in on 9 of them. We had 5 grantees from Alaska, 2 from Albuquerque, 5 from the Bemidji area, 3 from California, 3 from Great Plains, 3 from Navajo, 4 from Oklahoma, 6 from Phoenix, and 2 from Portland. And all of the different tribes had overlapping areas of injury prevention. The pie chart on your screen shows you that the majority of them focused in on motor vehicle safety and child passenger safety. The difference between those being that those tribes who focused in more broadly on motor vehicle safety may have done a child passenger safety program as well as other programs. And then the tribes who only focused in on child passenger safety, they didn't have other aspects of their motor vehicle program, but they could have had an overlapping fall prevention program or done some coalition building or a drowning prevention program, for instance. But that's just to give you a flavor of what the tribes were doing. And also, in that vein, Nancy highlighted for you several of the tribes that did extremely well with their programs. And what I want to do now is just kind of overview all 33 tribes so you can see that almost all of the tribes had a child passenger safety program. And many of the tribes also had a motor vehicle program. Nancy mentioned one of the tribes that had a bullying program. But of these child passenger safety programs, they were able to distribute car seats, provide education on the proper use of car seats. As Nancy mentioned, they were able to get more certified child passenger safety technicians in the tribe or within the region of the tribe, and they worked very diligently to influence tribal policy such that when we talk about sustainability a little later, many of the tribes took on the responsibility to keep the program going after the Indian Health Service funding ended. In the motor vehicle area, seatbelt programs were the most common, but we had several tribes that did programs to reduce driving under the influence, and several tribes who did a combination of things such as seatbelts, child safety seats, and perhaps distracted driving. So there were a lot of distracted driving programs as well. And you can see listed on the slide there the other programs. The other largest area that the tribes focused in was elder fall prevention. So what you can see is that the tribes had some challenges, as all injury prevention programs have starting out. And the three major challenges, Nancy quickly touched upon those as well, were the turnover of the lead person for the program, the injury prevention staff person, the ability to get a program up and running in a rural environment, and then finally being able to collect data and document what your program has done from the very beginning to the very end. And the technical assistance contractor, which we were a part of, were able to work with the tribes to overcome these challenges. So things that we did for staff turnover included working with the new coordinators to ensure program continuity. For instance, when a injury prevention staff would say that they were leaving, we would make sure that the regional IHS officer, the federal office, as well as the TIPCAP TA provider had all of the latest information and was able to help the new person within the tribe pick up where they left off and not lose too much ground. In working in a rural environment, again, the collaborative effort between federal IHS, the regional IHS, the tribe itself, and the TA coordinator were able to work over some hurdles to learn, use lessons learned from other tribes to overcome those things. And then finally, for the lack of data collection and documentation that sometimes is involved in new efforts and burgeoning efforts, we were able to provide as a TA center tools and resources to make data collection a little easier. And we're going to go into, in a few slides, some of those things that we did to help collect data on a universal level for all 33 sites. Over the course of the 4 years, the TA contract was in place for 4 years, we were able to field 528 requests for technical assistance. That's roughly a little over of 2 per week. And we were also able to provide IHS with 209 reports or event summaries. The annual workshops that Nancy spoke about and showed you a picture of, we were able to produce 203 member profiles, so the people coming to the annual workshops, what they were working on, and their picture to help interaction and increase networking among the tribes. Each year we did grantee worksheets for IHS on each of the tribes, so if tribes had a change in their goals, if they changed some of the ways they were implementing their program, and as well as collecting their most updated data, we were able to provide that. Over the course of the 4 years, we conducted 121 site visits. We supported all 33 grantees. We were able to produce 15 quarterly newsletters, host 9 webinars, and plan and conduct 4 in-person meetings. We also built and launched 1 online data collection platform, and this was to help coordinate what was being collected by all sites in the areas of seatbelt use and child safety seats. So to do all this, we had a TA process, and you can see that TA requests would come in, and we would provide oversight and monitoring of those requests as they came in. And then because we wanted this project to be sustainable beyond the life cycle of the grant funding, we had methods that we would follow so that the injury prevention coordinators, if they were able to continue with other funding that they found or they participated in future efforts, they could follow those as well. But some of the methods were after you established your program, collecting data on your program, making sure that you had a data collection instrument so you collected the same data each time from events, etc. We would then implement these activities. We would deal with any challenges and solutions that were specific to the site. We would share challenges and solutions from other programs and other sites. And then we would apply those successful strategies through dissemination methods, whether it be the annual meeting, the newsletters, in the injury prevention coordinators reporting back to their sites or to their tribal leadership of where they were going, what they were doing, and then as they would begin a new year of program implementation, the cycle would start all over again. And we found that this helped us do several things with the TA, and that included when the sites were able to implement their comprehensive programs, we were able to provide capacity building support so that with each successive request, the pattern was recognized and hopefully less TA help was needed, or the new TA help that was needed could be rolled out to all of the sites so that everyone could get an advantage of it. And again, that was done through the annual meetings, through the newsletters, and other interactions such as webinars that we had. We wanted to make sure that the documentation of the program was felt in the communities. And so we worked with the sites to make sure that they had it could be a 2-page flyer that they would pass out to tribal leadership about what happened, an impact statement, we called it, in their communities, to writing up an article that went in the newsletter about their specific program so that other injury prevention coordinators could learn from it. And then we also wanted to focus in on some immediate goals so that every site who was doing work could feel immediate wins and then focus in on their longer-term goals. And for that, we wanted to make sure that we had some short and longer-term program efforts where the fact that we got people to come to the brand new classes that were being rolled out, there's a short-term success. And now we want to go and do more seatbelt observations to make sure that the classes are encouraging safer motor vehicle traveling practices, and that would be a longer-term intervention. And we would work with the sites, again, to improve those interventions every year of their multi-year funding cycle. So for some specifics, I thought we could talk a little bit about the overall seatbelt, what was done with overall with seatbelts in the TIPCAP sites. So as we've already mentioned, seatbelts were a big component of many of the programs, and the data was carefully tracked by the TIPCAP staff, and they did this through a lot of time and investment and observational data collection. So over the course of the program, we saw an upward trend in seatbelt use for both drivers and passengers. We see that we observed nearly 138,000 drivers and over 38,000 passengers to collect the seatbelt data. And in the bar graph, you see that the trend lines for both passengers and drivers are a little erratic, but they do clearly show an upward trend over time. And the national average, which is the top line, is at the end of the program, the drivers and passenger rates are much closer to the national average than they were at the start of the program. But aside from this comparison to the national average, the before and after comparison of what was going in the programs is also telling. In the beginning of the program, by looking at the pie charts, you see that only 38% of drivers were observed wearing their seatbelts, and 34% of passengers were observed wearing their seatbelts, while at the end of the program, 73% of drivers in the aqua blue shade of the pie and 66% of passengers in the same color in the bottom row of pies were observed wearing their seatbelts. And so this progress is very clear. And so the work of the TIPCAP programs is greatly appreciated to make motor vehicle safety in a much better place as a result of their efforts. And we see the same for child safety seats. The programs had a high level of success in collecting and distributing child safety seats. So 8,900 seats were distributed, and of those seats, 6,800 were checked to make sure that they were installed correctly, and there were 1,100 child safety seats which were replaced or corrected with the way that they were installed. And just for a little bit of background, you have to understand that some of the programs would have child safety seat checks where the certified technicians would check installed seats or install seats in cars that didn't have seats, or correct seats that were already in cars. But the sites also would sometimes distribute seats that were separate from a child safety seat check. But the parents or caregivers who were coming to get the seats were required to get some education on the proper use and installation of the seats if they didn't do it in conjunction with a child safety seat check. And so now we have some more success stories, not just the seatbelt and the child safety seat success story that Kai Baker-Stringfield are going to talk to us about. Kai?
Thank you so much, Monique. First, I just want to say it's important to really get a sense of what the grantees did on the ground to fully appreciate the changes that occurred in these communities. There were very many successes across the program, but I'm going to highlight 4. And I'm happy that we have a current TIPCAP site on the webinar today to share their many successes with us. Most focused on transportation safety in addition to other focus areas, as Monique mentioned. But there were many approaches that the sites used to successfully impact their communities in the IP field. So starting with Pueblo de Jemez, this site was in the Albuquerque IHS area and focused on transportation safety and elder fall prevention. This program showed the importance of collaboration and education in their IP efforts in the area of transportation safety and elder fall prevention. One of their biggest drivers for success was organizing and maintaining a partnership with the Jemez Pueblo Injury Prevention and Safety Coalition. Their elder fall prevention program focused on home assessments, but a lot of their efforts targeted the youth of the community through outreach and educational campaigns in schools. They also distributed safety equipment, including 429 car seats, 422 bike helmets, and 22 ATV helmets, as well as 494 smoke alarms. Overall, their program reached 2,100 individuals with outreach and education sessions, and they were able to sustain operations following the end of the TIPCAP grant funding. The next site, the Oglala Sioux tribe, is in the Great Plains IHS area and focused on transportation safety. The IP coordinator at this program really stressed that education is key, and their strategy demonstrates their goal to really enhance transportation safety. Through radio broadcast, they were able to reach 6,000 individuals on an ongoing basis, And they also provided outreach and education sessions in schools, health fairs, powwows, and athletic events. The site distributed 2,259 car seats. They saw the usage rate of car seat safety seats increase from 8% to 78%. The next success story is the Quechan Indian tribe, located in the Phoenix IHS area, and had 3 focus areas, including assault, domestic violence, transportation safety, and elder fall prevention. This program took a more individualized approach to injury prevention, which was unique. In their efforts to prevent elder falls, they enrolled 90% of the area's elders in a case management program. They used a similar strategy for improvement of transportation safety. Program staff worked continuously with a group of 120 parents to meet their individual needs, including car seat distribution and ongoing education and outreach. In the end, they saw a car seat usage rate increase by 150% to a high of 70%. And the last success story that I'm going to mention is the Gila River Indian Community Injury Prevention Program, which had far-reaching impacts. Partnership and careful planning really drove their success. The program was able to distribute 1,588 child safety seats and train 1,100 parents and caregivers on their proper installation and use. They also sponsored 16 individuals in the community to obtain their child passenger safety technician certification to contribute to the availability of ongoing support in their community. So all of these success stories, while they operated in slightly different ways, had common strategies and themes that were present throughout the program. A few of the takeaways include collaboration is key. It's important to use data to motivate partners, community members, and really drive program decision-making. The programs found new approaches to solve challenges and look for new resources and information that could really be applied to their specific and unique situations. With that, I'd like to turn to Norma Bauman, who will be presenting her experience as the IP coordinator for the Navajo Nation Department of Highway Safety TIPCAP program.
Okay, good afternoon, everyone. So I'm going to talk a little bit about what we see as far as the Navajo Nation is concerned on the different things that we were able to do within our program with TIPCAP. And so our primary focus, of course, is to think about our future and our children and making sure that things are safe for them as they continue to use the roadways throughout our nation. On this slide, you'll see that our strategic goals have been to increase the correct usage of child passenger safety seat usage by way of education, distribution, and enforcement throughout the nation by at least 10% per year. Our number 2 goal is to increase current seatbelt usage by way of education and enforcement throughout our nation by 10%, and then to reduce injuries and fatalities caused by alcohol-related motor vehicle crashes by 5%. If you'll see on the top left-hand corner is kind of a glimpse of what our nation faces as far as how big we really are. 27,000 square miles, about a 6.5-hour drive from one end to the other. And so we really have to be out there in a diligent way so that we can make sure that our people understand what's really happening and occurring on our nation roadways. And so within our department, our area of responsibility has been to provide injury prevention, education, and awareness throughout the Navajo Nation communities. We do have 110 communities throughout our nation, and our focus has been to try to have some sort of presence in these communities so that we can share traffic safety education. We support campaign drives that are happening, whether it be nationally or statewide throughout our nation, so that folks can understand that we share the same intent, and that is to provide traffic safety awareness. We support our community events and carry out marketing initiatives throughout the community so that folks can understand. We also do child passenger safety technician courses annually throughout our nation. What we used to do was provide at least 1 to 2 courses on the nation, but we've been seeing an increase of maybe 4 to 5 where we're able to build capacity by certifying child passenger safety technicians throughout our nation so that when we conduct the safety education awareness to our parents and caregivers, that we have a lot of folks that we can tap into to provide that type of awareness. We also conduct checkpoints and child passenger safety surveys so that when we are providing education in these communities, we can let them know locally what their rates are, and that kind of stirs interest in the folks that we're educating. We do provide child passenger safety education in our communities and identify car seat program outlets with our partners. We do have a lot of partners throughout our nation, which has made our attempts in educating parents quite successful, because now when parents call, we can actually refer them to people locally so that they can get the assistance and education that they need. We also coordinate the Safe Kids Navajo Nation Coalition. We've had this coalition in our nation for quite some time now, and our membership has risen so that, again, it's all about partnerships, because we can't be successful without different folks climbing on board in the different communities. We do collaborate with the IHS Indian Health Service injury prevention teams throughout the nation, and then collaborate with our public safety programs such as law enforcement and emergency medical services so that they can assist us as well in our initiatives. So in 1988, the Navajo Nation passed a primary enforcement law for seat belts and child restraint usage. And what we were shown in 2002 was that we saw a 50% reduction in motor vehicle injuries for children and youth in the nation comparing to before the law was established. And in 2013, we revised the law so that we could get specific as far as what the children needed to use in the different age groups, including making an emphasis that children 4'9" still need to be in some sort of safety device because they cannot adequately fit the vehicle's seatbelt system, and that has helped us tremendously. In the education and marketing area, what we started to do was to make sure that our marketing tools that we're using is done in utilizing our Navajo language, because again, as I said before, we have 110 communities, and some areas their Navajo speaking is predominantly the language utilized at home. And so when we were doing our marketing areas, we wanted to make sure that when Grandma and Grandpa sees the things that we're doing, that they can understand what we're trying to emphasize on making sure that they're safe when they're utilizing our roadways. So what's next is we need to continue to educate our citizens of the nation. We want to be able to continue our promotion of awareness to our schools and communities and continue to collaborate with outside agencies, including law enforcement. We want to promote the highway campaigns nationally and locally, and again, raise our awareness on campaigns specifically targeting drinking and driving, the high rates of texting and driving, and restraint usage throughout our nation. And with that, we'll move on to the next speaker.
Thank you, Norma. So to wrap up our webinar this afternoon, I wanted to turn your attention to some of the broad findings from our experience with TIPCAP that may be useful to you as you move forward in implementing a wide array of programs. So what are some of the lessons that we can take from TIPCAP? There were 5 things in general that seem to be consistent across the most successful TIPCAP programs, which has led us to these conclusions, which we hope will be helpful in your injury prevention efforts. A collaborative approach is a key to reaching the goals and creating a sustainable program. It's important to have tribal leadership as well as the community, buy in to what is working together and to own the program and its results in order for it to be successful and sustainable. Using data throughout the program motivates partners and community members to enhance the impact of the injury prevention program. In the chat box, we received a question from Colleen Gerber earlier in the program about what happened in year 2, quarter 2, when I was displaying data earlier, and we were not following through this. We weren't using data to motivate to continue on, and we had staff turnover. Some of the sites stopped collecting data, and we actually don't think that seatbelt use dropped that much and increased that much between those 2 quarters. But it is true that we didn't have any data collected to show what the seatbelt use was, and so data collection is very, very important, as well as reporting on the successes of on an ongoing basis will help maintain community motivation and momentum. Once the first steps are made to show that a program is working, we found that communities tend to stay motivated and keep the momentum going if you keep reporting out on what's happening as opposed to you never hear anything. We also found that accessing new information, creating new resources, and sharing best practices and successful strategies with others who are doing similar work is very important to promoting successful programs. Again, that comes back to collaboration, and that when facing challenging problems and issues, it's very helpful to hear what others are doing to motivate you to keep moving forward in what you're doing, as well as to get resources that are very helpful and effective. And to that end, IHS promotes the CDC-approved injury prevention practices, and the programs within the TIPCAP used several different things. We list some of the popular ones here: A Matter of Balance, the Safe Kids program, the Healthy Homes program, the Ride Safe program. And again, IHS promotes all CDC-approved programs for the sites to use, but they are welcome to use whatever they find. They're encouraged for it to be evidence-based. And so the bottom line is, we didn't want anyone to reinvent the wheel, but to use what others had already figured out were working and then to adapt it to meet their needs. And so to provide effective technical assistance, we found that successful programs wanted several things, and that included, again, the collaborative nature, not taking the TA into a black box and giving it back, but working ongoing with the sites. For many sites, we had biweekly calls where we'd be working through an issue with the sites, providing assistance, as opposed to, here's a problem, we're going to go away and then come back, give you something. You don't know how we came up with this, but use it because we said it was the right thing to do. Sharing resource and materials through the quarterly newsletters and the in-person workshops proved invaluable. The newsletters became a great resource to pull up reliable information and have it readily accessible. IHS would publish the 508 compliant newsletters on their website, so that it was very easy to go back and refer to, and it was also a great guide for sites to use to refer others to what they were doing in the event that they didn't have a website or other online promotional materials. Providing the best practices that were tried and true from other grantees. This is done in the TIPCAP guide that IHS puts out at the start of every program and updates every year. It's a how-to guide for the sites to use throughout the life of the grant cycle. And it pulls together all of that collaborative learning. Each year, new things are added to the guide, new resources, and when they move from contract cycle to contract cycle, the TIPCAP guide is updated with the best from the previous grant cycle to move into the current grant cycle. And then finally, spending meaningful time on the ground with each of the grantees and their programs was invaluable. The site visits that the TA team conducted were useful to get a better idea of how the sites were being operated, the kinds of issues that they were dealing with on a day-to-day basis. And it was also beneficial to the grantees as it allowed our staff for some real-time face-to-face TA support to deal with the issues that were going on in their sites, as well as the site visits helped bring some visibility to the injury prevention programs because the TA providers would often meet with the supervisor and other leadership of the injury prevention coordinator. And so some important factors for sustainability as we wrap this up so we can get to your questions that haven't been answered. Again, the project revealed that it was very important that we have a commitment from tribal leadership. Sites that didn't have a commitment from tribal leadership were definitely not on the high end of successful compared to the sites that did. Retention of the injury prevention coordinator, the turnover in staff, the gap between hiring caused a lot of programs to lose their momentum. We did, as I mentioned earlier, find that TA was very helpful in helping with the continuity as well as the support from the IH Regional Project Officer and the federal office, but keeping those positions filled really helped move the sites along in their overall program success. And then, of course, support for capacity building and partnerships. Early on in our presentation, we mentioned that some sites had a specific program goal to build injury prevention partnerships. These proved invaluable because they were able to rely on those partners if a site had to undergo a funding cut for any reason. They were also able to rely on those partners to help with the sustainability of their program. Some of the partners became certified child passenger safety technicians. So if the site doesn't have current funding, there's still certified child passenger safety technicians in the area who can check car seats. Making a community impact. Implementing comprehensive injury prevention programs in the areas of motor vehicle-related injuries, unintentional fall prevention, and violence prevention that were tailored to the needs of the tribes help make a community impact on the short and long term. And documenting that output allowed the tribe at the time as well as now to show others what they were doing and to move forward as a way to show that this site could be successful in implementing a program and hopefully securing additional funding. So we want to thank you for your time today, and in our remaining minutes, we would like to take your questions. And Cindy or Rebecca, you have to remind me if you're going to help with the questions, or should I take them from the Q&A box?
Yes, Monique. Monique, thanks. This is Cindy. I'm going to start with the questions. So thank you all so much to each of our four presenters. Terrific information that was shared. We have a lot of great questions, and we're going to try to get through as many of them as we can in the remaining time. To our participants, if you have a question, again, just please type it in the Q&A box at the bottom left of your screen. So let's start with a question that it's probably pretty predictable. Nancy, there's a question regarding funding. One of our participants wants to know, will IHS be funding injury prevention grants again?
Yes, thank you. This is Nancy Bill. Yes, we have. We started the new cycle, 2016 to 2020. We have funded 23 grants. So, yes, we have a new cycle going currently. Thank you.
Great. Okay, thank you. Thank you, Nancy. Monique, a question for you. How did you share the results and the successes of the programs back with the grantees?
Well, Cindy, we did several things. We did the quarterly newsletter where we would produce articles of our TA activities, or we would ask the site to write an article because we were working with them on a TA activity. We had the in-person meetings where the sites presented to each other about their results, as well as the TA team would present overall results in working with all of the sites, such as the seatbelt and the child safety seat data that we highlighted, that we helped the sites to collect and collate. We also would do individual TA with sites, such as we did some impact statements. It was a 2-page flyer, if you will, that helped the sites really pinpoint one aspect of their problem, program what the problem was, what the issue was, what the current legislation was, what the site was doing, what it was, what the data showed before they started, what it showed currently, to get the message out.
Great. Thanks, Monique. Let's see where to go next. So, Norma, perhaps this is a question that you would like to address. One of the participants asked, how did you get the support of tribal leaders?
I think it really depends on the current administration. Every 4 years we have a new election, and a new president for the nation is elected in. Along with his appointment or selection is the appointed directors of all of our divisions. And so the best way is, as soon as they're entered into office, you make meetings with them, you sit down with them, let them understand what you're trying to address, where you're at currently, where you've come from, so that they have a better understanding. It's all just about keep on keeping on, so to speak, and letting them know what faces the nation and where they can assist you in your efforts. Thank you.
Great. Thank you, Norma. Kai, a question for you. Can you describe how the Sioux tribe sustained their program after the TIPCAP funding ended?
Nancy might be able to chime in on that as well, but
sure.
They are Part 2. Oglala Sioux got Part 2 funding, right, Nancy?
No, that's not correct. They are continuing their program with the Indian Highway Safety Program, or the Bureau of Indian Affairs have funded them. I don't know the extent, but I know they have continued funding from the BIA.
Okay. Thank you. Nancy, there are a few questions or questions from a few participants who want to know what is happening in their specific regions regarding tribal injury prevention. Could you just talk a little bit about what's the best way for them to make those connections?
Yes, I'd be happy if people could send their question to me by email at nancy.bill@ihs.gov. I'd be happy to connect you with our staff or partners out there that work with Indian Health Services, with the tribe, and with our staff. So yes, if they can send me their contact information, I can make that connection.
Excellent. Thank you so much for that offer, Nancy. That'll be really helpful. And actually, one more question for you. Can you answer this from a participant regarding laws? Do motor vehicle or other injury state laws also apply to tribal areas?
Yes, it really depends if the tribe has their own jurisdiction in terms of law enforcement. Some tribes have that. Some tribes have state jurisdiction over them. The 280 states, they call them, and that's Alaska, California, Wisconsin. But there are it varies from tribe to tribe. But yes, and in terms of cross commission with state and tribal officers, that also happens throughout the different tribal communities. Some tribes have that cross jurisdictions. Some tribes do not. They only have tribal law enforcement. And even within tribal law enforcement, you have the BIA police officers versus the tribal police officers. So it all varies throughout each of the tribal nations. So if there's a specific tribe that person would like to know about, they can also send that question to me as well. Thank you.
Thank you very much. And looks like we've got time for just one or two more questions. Very quickly, Nancy, one of the participants wants to know if there'll be funding opportunities for any East Coast tribes.
There was opportunity for the East Coast tribes, and that our funding announcement went out in 2015. And so yes, if they can, right now we don't have any announcement for funding, but yes, but when the announcement did go out, all the tribes were eligible.
Great. Okay, thank you for clarifying that. So unfortunately, it looks like we are at the end of our time today. I'd like to thank our presenters, Captain Nancy Bill, Norma Bauman, Monique Shepard, and Kai Baker-Stringfield for their informative presentations. And finally, we have a quick evaluation of today's session. I hope that you'll take a moment to complete this. So again, thank you to all of our speakers and to you, our participants, for joining us in today's webinar. Hope you enjoy the rest of the day. Bye-bye.